You see, everything that big pharma does now is made to make you sick so they can make more money.
Yeah.
So how to know that you're getting a heart attack?
Hmm.
This is very important because people don't know. Most people have got that acid reflux. Your cough is your second heart.
Yes.
Yes, it's correct. Women's heart health is highly dependent on estrogen, which acts as a protective shield against your cardiovascular disease. Having said that, women do tend to live much more even with their disabilities. So we have to be alert and we have to give this knowledge to everyone.
Hmm. Hi, welcome to our podcast, Women Wellness First. I am absolutely honored to have Dr. Chopra on my podcast. I have been waiting for this day. We've been planning this for a while, but because of Dr. Chopra's very busy schedule, we couldn't do it. But I'm so excited to have him because he is a famous cardiologist who then in the last 10 years has also introduced functional medicine in his practice, and he talks about holistic health and how you can actually not only improve your heart health through functional medicine, but you can also overall improve your health, and which is where it really resonates with me, because that's what we do with nutrition lifestyle. When we make plans, we talk about holistic health, we talk about lifestyle changes which can really bring the change that we are looking for. So very excited to have Dr. Chopra on my podcast. Welcome, Dr. Chopra. Thank you so much for having me.
Thank you. Yeah.
So you're hardcore cardiologist and now moved into functional medicine.
Yes. No, I still do that stuff, but there are too many people doing the actual nitty-gritty of heart disease when they're putting in stents and all that. That I had taken out long back because I found it a little boring. I mean, it's very good for people. I used to do a lot of stenting all the time.
Yeah.
But then there are so many people doing it. So I realized that, the stent is one thing. So it's a mechanical thing for someone. It's mechanical for the person. So rather than that, I thought that I should create a lifestyle change for them so that they don't need to do that. That's how I converted back into functional medicine.
That's amazing, because not many doctors are doing that. Like they are
Because they think that if they don't do that, then that's over for them. So functional medicine has a huge aura from left to right, from what to wake up, what to eat, what not to do.
Yeah.
So lifestyle is very important, and over time, I don't use any supplements. I mean, supplements maybe, or some supplements mean routines things, but no gadbad nahi.
Yeah.
कोई ये नहीं कि वो करो वो दवाई लो ये नहीं. So I don't haven't used any medicines now for so many years. हाँ कभी कुछ सिर फट गया तो कुछ करना पड़ जाता है, but otherwise I don't use anything, and I insist to my patients also to work your life to live without medications, because medications were never there. If you remember, in olden times, people never died. They lived till 100, 105. तो वो भी खाते पीते थे, बड़े मोटा मोटा खाते थे.
बिल्कुल.
तो अभी भी हम मोटा मोटा खा रहे हैं, but we're eating things which are made not the right way.
जी.
So we have to go back to our ancestral past. It doesn't mean that we should become ancestors, but that's what they used to do. They used to walk, they used to do this, they used to meet people, they used to meet people together, talk to their friends. अब तो टाइम नहीं होता किसी को करने का.
जी जी.
So it doesn't mean that we should be oldies of the back.
Yeah.
But we should be doing that.
Yeah.
That's how the work becomes.
So जो हमारे देखने वाले हैं, I mean the audience that is listening to this, would you actually just tell us what functional medicine is? And how
the
is
word
it different
functional
from...
medicine is a funny word. It's a misnomer word. Functional medicine actually means that it looks at the function of all your organs. That's as simple as that.
Okay.
So everybody thinks that functional medicine is a different thing. No. Functional medicine means that it is looking after the functions of all your body. As simple as that. So nothing strange नहीं है. वो नाम ऐसे पड़ गया तो उसका people are thinking about functional medicine.
जी.
Functional medicine means doing the things right from morning to evening. That's all really, not than that.
Okay, so
there is a way of starting your day and ending your day.
Okay.
If you do that, then I would say that if you do it properly, like I do, I don't take any medications and all. Once in a while, कुछ हो गया तो अलग बात है.
Yeah.
So again, we can say that functional medicine, however, odd the name is,
जी.
it tells us that every organ in our body is connected. But we are looking at it कि जी मेरा liver खराब है, मेरा heart खराब है. अगर आप liver खराब है, तो heart भी गड़बड़ करेगा. So what she said is great because it covers everything from the head to toe, how you breathe, how to do that. I was coming to that.
जी.
That how your day goes. So, but the question is, functional medicine covers all the gamut of eating, drinking, working, thinking. So that is why functional medicine, the name is odd, but it means that it covers everything in your life.
So then, if you're looking at changing the way we are living, what are the few things that you would do? How would you lead a normal life which can be adopted by
You
most
see,
of us?
mostly I ask, my first question to my patients is, number one question is, how are you feeling?
जी.
Because the first always come and hand me that whole ABCD. So I say, I'm not concerned about that. They're looking at me, wo kya, ye kya. First, what time do you wake up? How are you feeling? These are the 2-3 things. First, tell us that. So I start the thing like that. How are you feeling? And what time do you wake up? And what do you do after that? So normally speaking, maybe 90% of the people, even the people who are working well, will wake up at 7:30. आप कितने बजे उठते हैं?
6:30.
चलो. So I wake up at 5:36 के बीच में, and I don't dilly-dally in bed.
Okay.
So the moment my eyes open, I just jump like a dog and like a rabbit, and I run down the stairs and I do barefoot grounding. That's the first thing, because if you miss that, then barefoot grounding on wet muddy grass is lost because it's only for a short period.
जी.
So people say, "Ki, what's the big deal?" It's a real big deal because that period is very small, and that period must be utilized.
So वो जो ओस होती है घास के ऊपर जो ओस जमी हुई
So
होती
वो
है.
जो that we call it grounding or earthing
Okay.
in a way. So you walk on wet muddy grass. What happens is that I did one thermographic study
Okay.
which showed that when you're walking and you're seeing that the legs are looking inflamed and magenta colored and red colored, inflamed, and after 10-20 minutes of grounding, it becomes blue, green, and indigo. And I said, wow, man, here there's a sea change, a color change in those thermographic studies.
Wow.
So that tells me that it's real. So the grounding and this thing comes that it takes the inflammatory things into the ground forever, and the rest becomes good. So grounding is not just the word grounding, it works very well.
Okay.
But timing is
important.
After that, I normally do a quick high intensity interval training. You know what that is.
Yes.
Yeah. So that way you have covered up something.
Yes.
Third thing I do is to do some pranayam, 3 pranayams at least. Pranayam to 16 star होते हैं, but the 3 major ones are Kapalbhati, as you know. Then we do Anulom Vilom, and then we do this thing, Brahmari.
जी.
So these 3 things are actually quite crucial. And if we do that, we've done quite a lot.
Yes. So I have actually done a full meditation course, and I have made a series on
Beautiful.
pranayam,
Wonderful.
where we explain the scientific reason why pranayam actually works on your health. So very, very close to my heart.
See,
And
meditation
so-
and pranayam are different.
Yes.
Meditation is something that we have to learn. It took me over a year to really meditate. It's not easy.
Not easy.
Because you're thinking and something else comes in it. So it took me actually a year. So how I actually did was that I sat here and then there was a bridge in front of me one day. I was just sitting and I saw one car coming from there, another car coming from there. And usko karte you got into a sort of a thing. So that was the starting point of the meditation. Now I find it very easy to do.
Okay. Okay. So how long
It's
should
not difficult because itna kuch ho jata hai na, somebody thinking or that suddenly something comes in your head.
yeah.
So meditation is not an easy task. It took me quite long to do it.
Yeah. And pranayam कितनी देर करते हैं आप?
Not too long. But I do the ये जो 3 तो करने हैं बाकी टाइम हो तो आ करता. So 3 are always in any case.
Okay.
I also do something extra. For example, I walk backwards. So backward walking does something magical, but provided you walk back erect.
Okay.
So I started using it, and my God, it was really something else.
Amazing.
So I do that every day also.
Okay.
Even in my swimming pool, I do ulta.
Okay.
I have a pool at home, so walk backwards, and that's better fun because you're doing the pushing the water as well. So
Because I think the resistance that you get from
Yeah.
water, that really helps to build your muscles as well, and it's really good. Even if you're walking inside a pool, that can really help. And you do the backward walking.
हाँ तो इतना कुछ कर करा के then I get back to bath and get back to work. So I've done so much already and it's only 8 o'clock. So I'm very happy that this has been done.
Yeah.
ये हो गया. Then I come back. I come back to the hospital a bit later than earlier people because I'm doing this.
Okay.
But it's just working very well.
Okay. And then food-wise, what do you recommend? Like,
See, I believe that veganism should be thrown away ever. Vegetarianism is good, but still it cannot match with non-veg food. But non-veg food doesn't mean to eat every day. Some amount of non-veg food is good for us. Only vegetables are good, no doubt. And I will never tell someone, no, you're doing something wrong because that's their way to living. So it's not wrong because vegetarians also are living very well. But if you put in a little bit of the non-veg foods, which could be not, bacon or things like that, but
Yeah.
something
simple.
simple, something simple.
Traditionally, जो हम लोग खाते हैं.
हाँ, मतलब small prawns, which are
Yeah.
not healthier than other things. Things like that, little shrimps. That much of vegetarianism is fine.
Yeah. Yeah. Okay. So, should we eat every 2 hours to maintain?
No. So you see, every time you eat, you need about 3 to 6 hours for the food to get digested fully. So everybody has started saying, yes, it's true, but we have breakfast, lunch and dinner.
Ji.
Now, breakfast was a British idea, not an Indian idea. No Indian use the word, तो हम बोलते हैं, but you don't need breakfast.
Okay.
So, according to our system, we should not be eating more than twice. Our bodies are made to eat twice because from ancestral past. And remember, our ancestral past is within us. So when we eat 3 times a day or more often, when आजकल लोग कहते हैं ना हर 3 घंटे खाने चाहिए, which is 3 घंटे में तो खाना बचता है. It takes the food to get digested. By the time you eat again and you eat again. So I think a very large number of people are being told to eat that.
Ji.
So what we do is that we do only 2 meals a day, and I start my day meal around anything between 12 and 2. उससे पहले I know that our eating window should not exceed 8 hours. But for people who can't, 10 is also okay.
Okay.
So that means if 8 hours means I've got 14 hours for rest, rejuvenation and repair, and that's what we need for our body.
Yes.
Which is why also our last meal should be early. Why? Because it takes 2 to 3 hours for the food to get digested. सुबह का तो पता नहीं लगेगा, पर अगर आप बहुत लेट खाएंगे तो अगर जल्दी खाएंगे से 7 o'clock or 6:37 your dinner, it will still take 3 hours to digest. So if you are eating late, your food is getting digested while you are sleeping, whereas you are losing out on all the 3 hours rest, rejuvenation and repair are not there.
Absolutely.
So but it's simple. It's simple. Life is very simple. People are saying, "Hey, ऐसे करेंगे डॉक्टर साहब क्या बोल रहे हैं आप?" It's not good. And then what else? It's so easy. If I put it out this way, it is easier than easy.
Absolutely. So food-wise,
then, sorry. Then what we do is that after that, I mean, my work is a little different, but what I do is that around, as I said, first meal comes around 2ish.
ठीक है.
And I often call some of my close friends to eat together.
Nice.
For fun.
Okay.
Also, I would do it alone also, but that's what I do. And then later in the evening, somewhere around, say, midday, little late midday, I take a quick, quiet nap for 10-15 minutes.
Okay.
Which is not a sleep nap. I have a recliner, which I can't do it every day, but mostly just recline and close your eyes and, start sleeping and just put it.
Like a siesta.
छोटा सा siesta, and that little siesta actually really triggers you back. ज़्यादा सोओगे तो फिर गड़बड़ हो जाएगी.
जी.
So I use this binaural beats very often. You know
Okay.
binaural beads?
Yes, yes.
So I am very, very fond of binaural beads. They've got hundreds of them and different ones. Most of them are simple, but there are people you can use those for sleeping also.
Yeah.
So you have a 6, 7, 8 hours one, and so I always put it on during that time and do that.
Okay. Amazing. What about fruits, tea, coffee, dairy? What's your
Coming to
take?
that. So fruit I'm starting with first, because every person I know nowadays starts their meal with fruit. Yes, you also do that?
No, I
Oh,
don't.
good.
No.
But most people will, I ask them this question, they say we start our meal with fruit because fruit is a damn good item, which is a very good. Of course, fruit is good. But fruit on its own is very highly glycemic.
Yeah.
So when you eat fruit on an empty stomach, it will, I mean, it will taste well, but it will get into your liver. It else is not going anywhere else. If you look back at our ancestral past of our fathers, our grandfathers, पहले खाना होता था,
जी,
खाना खत्म होता था, फिर फ्रूट की टेबल आती थी.
बिल्कुल.
They knew what was right. So, but there is a thing that नहीं fruit अकेला खाना चाहिए. There is a value for it. So when you eat fruit on its own, it's not mixed with the food. But at the same time, if you just sit down, let the food get a little bit digested, then the fruit comes.
Okay.
That is the righter way of doing it. You can ask your dad, your granddad will tell you
They
that.
always had it
तो
after
हमने
after
उल्टा
their
कर दिया
meals.
ना. You see, everything that big pharma does now is made to make you sick, so they can make more money.
Yeah.
So this is the sort of overall thing, in your day is very easy
Yeah. Yeah.
if you do it this way.
Yeah. Yeah. And what about dinner? Dinner would be what
Dinner
time
is
and what
smaller.
would you have?
If I'm not going out, then it's around 6:37, 7:30.
Okay. Okay. And
If
usually.
I'm going out, sometimes I go without eating, but mostly I will eat something and I'll have a soup or something over there.
Okay. Okay.
I'm a total soupy person.
So you like the soups?
Oh, I have multiple types of soups. I like it.
Okay. Okay.
Because it covers everything ना, because soup वो घटिया सूप नहीं है कोई.
नहीं, घर
उसमें
वाला.
गाजर भी है, ये भी है, वो भी है. Everything is thickish, not that thick, but
Okay.
so there are times when I have only that and a sourdough toast at night.
Nice. Okay.
Always that much. So sourdough is only because it's nice and crunchy and it's not all that bad. But bread तो खाने का सवाल ही नहीं पैदा होता.
Okay. Okay.
So
But you make your bread at home, you said.
yeah,
Yes.
bread is at make it at home, and I've made a sabji and something without anything.
Off camera, we were talking about this zero carb chapati that you have invented, I think. So, would love to know what all do you put in this and how does it work?
First, I'll tell you how it happened. I was wondering how to do it. So I went to, again, my meditation, and it happened during that meditation.
Okay.
And so I don't know, meditation works for me. So the meditation thing started by taking 4 flours: almond flour, coconut flour, jackfruit flour, and raw green banana peel flour, which nobody knows, but it works. You can
Wow.
try it, you can ring, just see and you will find that. So these 4 flours, okay. So what I do is I take some probiotic yogurt.
Okay, nice.
Probiotic yogurt, and I mix the yogurt with those 4 flours. So the
Okay.
flour softened up.
Okay.
Then I take all the greenies sabjis in the world and I mince them. Pani nikal jata hai. I keep mincing them till all the water runs out.
Okay.
And I mince it to powder.
Okay.
How does this happen? I'll just continue. It happened because I wanted to make a roti which does not have any carbs. So this came by manna from heaven, actually, because I prayed and suddenly something happened. So this came on its own. I don't think I made it, it came on its own. So I took all the sabjis and made it into powder. I took some nuts, powdered it. I took some seeds, powdered it. And I took some raw unsweetened cocoa.
Okay.
And then अब मैंने सोचा इसका फ्लावर कैसे बनाए, तो 4 फ्लावर हो गया, मैं 8 फ्लावर बनाने थे.
हाँ.
So then put the whole thing in a masala grinder.
Okay.
And make it like flour. Then we
Okay.
put all the four ingredients. Now we've got 8 ingredients for that roti. The roti is just delicious and nutritious.
Wow. That's amazing.
Nobody can beat it.
Wow.
Because look at the stuff that
everything good in it, packed in one.
उसके बाद फिर उसको थोड़ा सा उसमें चटनी घी वी जो डालना है आपको, you know, you can put that some Greek yogurt there, and it's done. Now I told them to make a bread maker. I mean, make nahi. Everybody has a bread. Do you have a bread maker?
Yes, I have. Yeah.
So that bread maker, you put the same ingredients into the bread maker.
Okay.
Put some baking soda, some fermented foods,
Yeah.
and you put it in that loaf-looking thing. So you've got bread with the same ingredients.
Amazing.
So what else do we need to live? We've got the perfect roti and the perfect bread.
Amazing.
You'll never get sick.
Great. And I'm told you've been having this for last, what, 7-8 years now? It's been.
More. वही खाता हूँ, I don't eat. कोई मेरे को फुल्का दिखाए ना, out.
Okay, out you go.
Out you go. Even the thing is like a paratha only, na, what I'm eating.
Yeah.
So अब but वो पुराने ज़माने की आदत है ना, stuffed उसमें सिर्फ डाल के, so we are still, that part is still there, so that means we are still real, you know, it's not that we are stuck in that thing.
Yeah.
So जो जैसे अब for example your ice cream. Now find me anybody who doesn't like ice cream.
Yeah.
है ना? But ice cream is not ice cream.
Not anymore.
It's frozen dessert.
Yeah.
So nobody wants that. So gelato is the thing. So we have gelato. My wife makes the best gelato in the world.
Wow.
Perfect. A lot of good people are making it. -3 is making, and there's a few other people.
Yeah.
But it is made into a vegan and sugar free. The sugar free comes from allulose. Have you heard of allulose?
Yes. Yes.
So it's made with that vegan stuff, and then you can put some whatever you can add to it, and you've got the best stuff.
Amazing. Amazing.
So that means your ice cream is not ice cream. It's like a different aspect of gelato.
Yeah.
The other thing that I do, which is my personal thing, is like सड़ा हुआ गाजर का हलवा. वो सड़ा हुआ इसलिए है कि इतना उसको काढ़ो कि वो निकल जाता है.
अच्छा.
So puts a lot of badam shudam in it, and then
Okay.
I have that.
Okay.
So I always have this plus this at
Acha.
night if I have to.
So these are your desserts, like favorite
These are the
sweet
two
things that
only
you go
two
for.
favorite desserts. That's it. No others.
Okay. Okay.
But everybody is eating foolish ice cream.
So what's your take on dairy?
Don't have
A lot of people ask
no,
questions.
no dairy is meant for bacharas. We are
Ji.
not bacharas. So no milk for anything. Milk agar hai to these are different types of milk available, but not doodh ka milk. Doodh has become, I mean, tell me who doesn't have doodh? दूध नहीं पिया होगा. आपकी माँ उठ के पहला ग्लास होता है दूध पियो.
हाँ.
बेटा दप्पड़ मारेंगे तो.
बिल्कुल.
So milk was never meant for humans.
And milk quality also is not.
Quality तो
has
अलग बात है ना.
It's
milk
like,
ही नहीं पीना तो quality की बात ही नहीं आती ना फिर.
Because what you get in those Tetra packs, वो दूध है भी नहीं, वो तो कुछ और ही चीज है. I think what all they mix in it, it's no longer milk.
Well, people are living like that, and then when they get older, then suddenly they get sick and they'll say, "मैं तो कुछ नहीं किया."
हाँ.
So we have to live long. Now you may say, why should we live long? Why not? Because actually after the age of 70, 75, everybody is starting to get old. This is the time to not get old. I'm 73, 74 now, but my chronological age is 54.
Amazing.
And we should all aim for that.
Absolutely.
Because this is our time.
Yeah.
Or my time. And you have so many things to do. You have learned life so well. You've lived life so well. You've helped people. Now I start doing conferences. I go to Goa twice or thrice, and we have a large group of people. I have created a scene from overseas people who come, and we talk about our personal thing. कि आज मैं करूँगा, कल वो करेगा. So we all listen to each other. फिर हम खाना पीना डांस वांस करके आ जाते हैं.
Very nice. But I think
we do at least twice, if not thrice a year.
Yeah. So I think that
and mostly it's Goa.
Yeah, it's nice. It's nice.
No, Goa is like a madness for me.
जी. But उसपे वही जो difference है लाइफ स्पैन और हेल्थ स्पैन का जो difference है कि लाइफ स्पैन तो बढ़ गया है लोगों का. They can live up to 80, 85 also, but their health is not great.
There's no point.
Mobility is not there. Their bone health is very poor.
That,
yeah, yeah.
So I always tell people that starting from the age 50, 60, do more strength training. That's the time, because when we are old, we need strength training.
Absolutely.
And strength training के बगैर तो कुछ नहीं हो सकता ना, because as we get older, we are going to lose our muscles.
Yeah.
So we have to do certain types of exercises for that, which I can show you if you like.
Yeah. So strength training for like an average 50, 60-year-old, how many
See,
times in a
I
week would
wake up
you?
in the morning and I do dumbbells first.
Okay.
Then I have a little, इतना बड़ा वो मेरा वो है एक वो डिकैथलॉन का ना फुल जोन है उसमें
Okay.
सब कुछ है.
Ha, the kit, that
And that
small
little
thing
kit.
that comes.
So I do that, do the dumbbells, do that, and then go ahead.
Okay. Okay.
So strength training भी हो गई.
Amazing. Amazing. And do you do that every day or do you
Every
need
day.
every
Every
day?
day. Every
Okay.
day.
Okay.
That's the value of getting up early, na? You can do all that stuff.
Yes. Yes.
So quickly.
So उससे mobility बढ़ेगी, उससे आपकी heart health improve होगी.
सब कुछ
Yeah. Your
strength.
you'll get more strength in your legs. You'll be able to walk faster and
There's
not
a
fall.
particular thing that we do. You'll be surprised that we have managed to reverse diabetes. Of course, big daddy diabetes, you have to do many other things. You have to do supplements and things like that. And there are methods. But we have done something which is so simple, which is called there is a muscle here called the soleus muscle. Nobody knows. You know what?
Yes.
It's a very thin muscle behind the crown. And that is called the soleus muscle. It goes right up to your brain. So it works the whole day. So you have a particular way of doing this. It's called soleus activation. Have you heard of it?
No.
No. I can stand and show it to you first. So I'm doing this while standing. Raising my heels.
Calf muscles, yeah.
And the calf muscles.
Heels, yeah.
And bring down slowly.
Yeah.
Sharp up.
Sharp
bring
down.
Sorry, yeah. So on standing, then I squat and do the same thing.
Okay. Okay. Okay.
And that is something. And I've seen diabetes running out. I mean, your sugar comes down. Wow, I said, my God, that was interesting.
Just by using your
Now,
calf muscles.
I'm talking to my patients, I'm doing this.
Yeah, yeah.
It's good for your calves. Your calf is your second heart.
Yes.
So, therefore, it works both ways.
Amazing, amazing. And this is so simple.
So what I'm saying is simplicity.
Yeah.
There's no medicine involved in it.
Yeah. And traditionally also they used to say when we used to squat, that was supposed to be really good to activate these calf muscles and that kept your heart health really well. And now we use.
Unfortunately, people squat wrongly.
Yes.
I can show it to you if you like later.
Yeah. Yeah.
How to squat is that you should not your knees should not go beyond your toes. Everybody is doing where your knee is going beyond your toes.
Right.
So it takes away the spunk of the thing.
Yes. Yes.
But that other thing also I have to show you. But that will have to lie down and show you on bed what I do on waking.
Okay. Okay.
That's covered. At least 50% of your exercise program or strength training is done
just in bed.
In bed, yeah.
Amazing. Amazing. So,
teeth and gums, I told?
No.
Well, at least twice a year, you must visit the dentist, whether you think that your teeth are okay or not.
Okay.
Everything comes from here. Everything you eat comes from here. So, first and foremost, you will see every time you go, you definitely need. You say, "Mere ko to kuch zarurat nahi hai," but you don't know what is happening inside, or maybe happening soon. So, dental work is a must.
So, cardiac issues have been linked with dental issues.
Now, let me tell you how you see cardiac issues is a very important thing. It can kill people. So, how to know that you're getting a heart attack? This is very important because people don't know. Most people have got that acid reflux, and acid reflux is common. So, you feel that and there's a constriction that happens. So, a large number of people are mixing acid reflux and heart next.
Okay.
So, what is the typical look for a heart attack? Typically, the heart is here. The heart attack feeling is here in the solar plexus region.
Okay.
And you will see people typically show that they're doing like this,
Okay.
That their face is fizzled up and they're holding back. Okay. And doctor ko bulao, wo kehte nahi acidity hai ji.
Acha.
So many people have died because of so-called acidity when actually it's a heart thing. This is a typical heart thing. Heart should not come here. Where? Mostly it's here. Then what happens is that this feeling can sort of go up and give you a throttling. And again, people think it is acid reflux.
Okay.
Then the whole gamut is this, then acid,
Jaws.
jaw pakda gaya.
Hmm.
And also the pain goes in both arms. That's the whole gamut.
Okay.
So that is a typical picture. Now you may get only fragmented things. Some people may only get this, some people may only get this. I had a patient who I was not in town, I was overseas, and he tried to call me. I didn't get to him. So he went to some डॉक्टर को उसी मेरे को यहाँ हो गई था तो किसी ने उसको कहा कि आपको एसिड रिफ्लक्स
अच्छा.
कुछ नहीं हुआ फिर उसको ऐसे हो गया वो डेंटल के पास उसने दांत निकाल लिए
Oh my God.
so people are not using their minds. Then comes the real thing. So people are not realizing that. So as I said, this then it comes down the arms. So you can have the whole thing, or only the heart attack is coming suddenly pain on both arms.
Okay.
So nobody thinks, how is this happening? It has to be something else. There's some of that.
Okay.
So I had this patient who he got this thing and he had gone to and he was really suffering. So then when I came back, he had this thing on the third floor. So by the time he reached the third floor, he started getting pain down his thing. He used to think कि मैं ऐसे चल के ऊपर जा रहा हूँ.
Okay.
So he actually was having a heart problem rather than this. So we have to be alert and we have to give this knowledge to everyone. Anybody who has this problem, you can tell them what I'm saying.
Absolutely.
Because at least they know how a heart attack works.
Right. Yeah, this is very, very useful.
Sometimes it's only the teeth, na?
Yeah.
So you have to be alert to that thing. Say somebody is having a heart attack and is having at rest. And if it's happening at rest, it means that you need to go now.
Okay.
So if you are having it when you're walking,
Yeah.
then you still have time. You have time to ring up somebody and say, take me to that.
Okay.
So people should know these things.
Yeah. Yeah.
डॉक्टर लोग बताते नहीं ना पता नहीं क्यों नहीं बताते they keep it to themselves till they get sick.
Yeah. So this is where you can spot.
So
कि
what
ऐसा
I'm
कुछ-
telling you is actually a whole day's lifestyle, and within that lifestyle, illnesses, how to handle them.
Yeah.
I think if we can handle that and eat the right food, create the right timing of eating the right food, you don't need to be sick.
Yeah. Absolutely. Absolutely. And you are 74?
Going to be.
74. And you
Okay.
have the most amazing, you're really healthy, you've looked after your heart and everything. So I think there's a lot of inspiration to be taken from that.
Yeah, a lot of women. I'm a feminist. She knows I'm a hardcore feminist.
That's amazing. That's
And
amazing.
I stand for women more than men.
Yes.
And I
So
make a big deal about it.
yes, I think we should all, and I think men more than women. I think
Yeah,
that's when
yeah.
we get heard.
Yes, but women are stronger than men. Let's face that.
Yeah.
And then my male friends don't like me for that. He says, chalu banda with us girls. But that's true. When you look at it, the woman of the house is looking at children, looking at the house, they're looking all sorts of things, they're looking at their husbands. Obviously, they're doing more work, so they're better off.
Yeah.
Better off, nahi, they're better people.
They're stronger.
And stronger, sure.
Absolutely.
lot of people को हल्का हो गया तो मरने को तैयार होते हैं. And then what happens? Their wives help them out.
Yeah.
So-
Okay, so Dr. Chopra, we also want to know about, because I've seen some of your podcasts and you have spoken at length about cholesterol and also the use of statins. So I really want to bring this on this podcast because I think it's really one of those most critical things.
You see, statins are very powerful agents.
Ji.
They really work very well. But let's say you get some temperature, some bukhar ho gaya, and you take some medicines, and your bukhar goes away, but you carry on your medicines. This is what they are doing. So statins are very powerful agents, and they're very necessary when they're needed.
And in fact, they say that once you're on statins, you'll have to take
Precisely. So that's what I'm saying. I'm giving you the analogy कि आपको बुखार लगा तो आप गोलियां खाते रहे.
Like
So
that.
they are telling them, the big pharma people want to make more money. And one way of making money is to telling them that statins, once you get into statins, you have to, and they force people to have statins.
200 cholesterol level पे I have seen
200 is the
clients
maximum.
asking कि अब आपको statin पे जाना पड़ेगा अगर 200 से थोड़ा भी ऊपर हुआ तो
नहीं ऐसा है कि if you look at what is the range,
जी
it is up to 200. It doesn't mean that you get 250 and you're going to die.
हम्म
Tell me, if anything is made in our body by God, can it be bad? Where does cholesterol come from? 85% of the cholesterol is made by our body. Did you know that?
yes
And if you go through that, I can get you a list of the 10 things that cholesterol does.
जी
So if there are 10 major things in your life and it's made in your body by the Lord, it cannot be wrong. Why is it made into a rope? What happens is that when you use a statin, and the statins work very well, but statins should not be used for more than X amount of time. If you have any गोली रोज की खानी है, सारी उम्र थोड़ा ना खानी है.
बिल्कुल
So they have created this thing so that you carry on the statins. Or if you use the statins more than 3 years or 3 months, you will start getting muscle.
yeah
You can get bone becomes very brittle. And in the long term, I've seen people getting dementia and Alzheimer's as well.
yes
Now, nobody will blame that, no? That's what is happening.
and
So
I think
you have to stop
probably
it, man. You have to stop it when, yes, of course you need them.
but
you
I
have to
think
stop
probably you're the only cardiologist I've heard that saying that statin should not be taken for all your life. यही सुना है हमने सबसे कि statin अगर आप एक बार चले गए उस पे तो you'll have to continue it for the rest of your life. But that's amazing to hear from you
it.
because that's very
Statin is an
reassuring.
outside item.
जी
You have to give it for its need.
yeah
Your body needs for X amount of time, not all your life. And cholesterol को उन्होंने बना दिया भूत. So if cholesterol has 10 jobs to do in the body, how can it be bad?
yeah
There's so much good work.
when should you start worrying about cholesterol कि अब cholesterol इतना बढ़ गया है या इस
नहीं,
when
find
does
out
it
what
become
caused it.
okay
You see, here, let's say this is an artery and there's a inflammation in the artery. Cholesterol comes to put a band-aid over it.
yeah
But you keeping on doing that, but it keeps on putting that band-aid till the artery gets clogged. So when you open the artery, you blame the cholesterol. That's the problem. It's not the other way around.
right
So everybody has been told that it's the other way around.
so then if you want to not want that plaque to deposit in your arteries to keep the cholesterol away, what is the underlying thing that we can work on?
It's not the cholesterol, it's the inflammation. The cholesterol is patching the inflammation, but the cholesterol has been made a rogue. You
Yes.
understand? It's the inflammation due to your activities, your lifestyle is causing the inflammation. And cholesterol is trying to patch the wound.
Yes.
But if you carry in wrong, the cholesterol will keep on adding. So the cholesterol gets the rap.
So he gets the bad word,
Yeah.
although the underlying issue is inflammation.
If it's doing 10 jobs in the body, how can it be bad?
Yeah.
But then problem to hai कि if you keep on eating it, cholesterol is clogging it. So your job is to change your lifestyle so that cholesterol doesn't clog.
So you need to bring the inflammation down.
Yes.
And what would be the main reasons why inflammation? Because
Inflammation is coming from lifestyle, what you eat, what you do, what all that. But the inflammation is a very generic, big word, you know.
Yeah, yeah.
Nobody can really define. Inflammation means that your body is inflamed, whether it's your head too or whatever.
So it could be the oils that we are using, the seed oils that we are consuming, or the sugar that we are consuming. Then because
see, we've already talked about I don't have sugar of any form. I don't have anything like that. We made our roti like that, and what's okay?
So that will bring the inflammation down, and then the cholesterol will be in control.
Nee, see, it's not the question of cholesterol being under control. The question is that we should not make cholesterol as a rogue. And if cholesterol is doing 10 jobs, why call it a rogue? You're using it wrongly. If someone says कि भाई आप एक गोली खा लो इतनी खानी है, आपको 5 गोली खानी है, पर मेरे को 50 खानी है, तो obviously खराब होएगा.
बिल्कुल.
So that's इसीलिए cholesterol का उल्लू बन गया. Yes, it can be wrong if you take it wrongly. Anything done overdone will make it wrong.
Yeah. So the LDL and the HDL, the bad cholesterol and the good
See, there is
cholesterol.
no such thing as bad and good. How can it be कि ये मेरा bad है, ये मेरा left, right. Left is bad and this is right. That's nonsense.
Yes.
It's already, it sounds like nonsense.
Yes.
So HDL, LDL are all working. It, of course, it helps, it works. It works as an action to see what's happening. It's not the cause.
Ji.
It happens to, because it has to create a cause. So, of course, you have to work on LDL and HDL and all that. But I don't use that anymore. I use a value of triglycerides divided by HDL.
Okay.
If you can do, you see, triglycerides are found in foods and everything. So, if the ratio of triglycerides to HDL should be around 1.5 to 2.
Okay.
If you maintain that this thing, then you're fine.
Amazing.
So, I tell my patients कि ये करो पहले, फिर HDL LDL की बात करेंगे.
Okay. So triglycerides
Divided by HDL.
और अगर triglycerides अगर कम करने किसी के बढ़े हुए आए हैं
Triglycerides का ना तो it's actually, I tell my patients कि just Google, sit down and work around that what कौन सी चीजें हैं triglycerides में.
Okay.
और उसमें देखो आप कौन खा रहे हो, कौन सा ज़्यादा है. So you can differentiate between very high triglycerides, medium or low. So if you have a problem, diabetes है, ये है, start with the low because it's part of our work. Same goes for uric acid. Now uric acid is found in all our foods. The same thing is that uric acid, the word range, I hate the word range. It from 3 to 7.5. So if it's 3, then it's what? So, so the uric acid also, actually the uric acid is also somewhat like sugar. It works like sugar.
Okay.
I was in the US one day and they said that your sugar thing and thing work hand in hand in one way because uric acid is found in all the foods. So you have to work out high uric acid, medium uric acid, low uric acid and start with the low uric acid. You can get it in the thing. You can ask for it कि low uric acid foods क्या है.
बिल्कुल.
Medium कौन से हैं, high कौन से हैं. So if you are having a problem and you have very high uric acid, then you come from the lower ones.
बिल्कुल. So you need
There's
to
a way out, ना?
yeah. So you need to work on your triglycerides level and
कोई
then
बताता नहीं ना कि 3 किस्म के हैं.
सीधे statin लिख के दे देते हैं. So that now you have to have this and for the rest of your life.
वो फटाफट बोल देते हैं. There's no way कि you can't go back again to something once goes wrong.
Yeah.
Why if you break your leg, then you'll have your disability.
Yeah.
It's not like that. Right?
Yeah. It's not like that. Yes.
The other thing is also how you walk, how you use your spine. That's very important.
Yeah.
I can show you how to stand and how to walk. Because most people are walking like this.
Spine is not erect.
Spine is not right.
Yeah. So, Dr. Chopra, you are a cardiologist, and it is believed that women, when they go through menopause and the drop in estrogen is one of the main reasons why they tend to have more heart issues than men. Is that correct? What's your take on it?
Yes, it's correct. Women's heart health is highly dependent on estrogen, which acts as a protective shield against your cardiovascular disease. So the abrupt drop of estrogen during menopause transition, which we call premenopause, causes a low estrogen state, and this removes the protection.
Okay.
This leads to a risk of heart disease, strokes, cardiac events, arterial stiffness, visceral fat gain, heart palpitations, irregular beats, etc., etc. All become more and more frequent. So it's critical time for the heart health as the earlier estrogen has provided this very particular protection. So what happens? Weight gain, higher inflammation, lifestyle changes, and definitely we need regular screening because of that. And lastly, not the least, hormonal therapy should be initiated early.
So, Dr. Chopra, this was very informative. So, what else can be done at this point?
Well, I think the last thing is that the hormonal therapy should be initiated early.
How much of the cardiac health of a woman depends on estrogen, and how much of it is dependent on the stress, the lifestyle, the diet, the nutrition that she's taking? How does this?
So, lifestyle, diet, stress, sleep, activity, exercise are very powerful drivers. But poor adherence to healthy lifestyle can cause at least 72% of coronary artery disease. So, you must understand that. And there is a 5 times more risk of heart disease as compared to men. These forces are not in isolation and are deeply interconnected with chronic stress, which catalyzes this problem.
So women tend to live longer than men, and but they have a very poor quality of life after menopause. Do you see this clinically in your practice that this is the trend?
Yes, women do live longer, but often spend too many years in poor health, particularly postmenopause. And in some cases, some symptoms can continue, like hot flashes, insomnia, etc. And this is the early part of the postmenopausal time. Loss of estrogen increases the risk of cardiovascular disease, which is leading cause of death today, including osteoporosis, urinary infection, and vaginal dryness. It also includes joint pains, weight gain, and sexual dysfunction, depression, anxiety, memory issues, and much more. Now, this can last quite a long time. So, cultural stigma and limiting training has to be handled. So, regular exercise, no smoking, proper diets, all are very crucial. Having said that, women do tend to live much more even with their disabilities.
So, how do we explain this longevity paradox where they have the disabilities and yet they tend to live longer?
So this is due to combination of genetics, that is XX versus XY chromosomes. Women have two chromosomes which gives them a big backup, whereas men have only one X and one Y chromosome. So if one single is damaged, then there is no backup. So hence more genetic disorders and faster cellular aging. Now there is a hormone protection for cardiac illness, especially prior to menopause, and this is crucial. There is more robust immune response to infections for sure. Also, there is a lesser chance of smoking, alcohol, high risk behavior while they visit doctors more often. Women live longer for sure, but they do face higher rates of sickness and disability later in life, including cardiovascular risk.
So, Dr. Chopra, there's a lot of noise around supplementation these days. So, from longevity perspective and from heart health perspective, especially for women, what are the supplements you think are genuinely important for them?
So, from a heart health perspective, which supplements does one genuinely believe are really working or helping? One reason is that lots of products are marketed without a strong clinical trial or evidence. However, a randomized, controlled, proper trial and several supplements stand out for female heart health. As the reason is for good triglycerides. So, blood pressure, medications, metabolic supplements, and substances, etc., are important. Supplements for raising estrogen postmenopausal are as follows: fruits like plums, pears, apples, grapes, and berries, vegetables like beans, sprouts, cabbage, spinach, grains, hops, garlic, and onion, others like wine in moderation, teas is matcha, coffee and caffeinated beverages can increase estrogen levels, especially in Asian population soya based drinks. But these contain phytoestrogens which mimic estrogen, and that affects like black cohosh or a Native American herbal remedy, especially for treating hot flashes. And that is with seeds, edamame, sesame seeds, berries, peaches, garlic, alfalfa sprouts, wheat bran, tofu, dried fruits, dates, prunes, figs, etc. Nuts like pistachios, walnuts, peanuts, almonds.
So, what are the things to avoid then in this case?
So, soya based foods, conventional dairy products, processed meats, refined carbs, sugary foods, excessive alcohol. You can have soya beans, flax seeds, rarely. So, apart from a detailed diet, I would like to add high dose omega 3. Fish oil like krill oil is much better than fish oil because it's cheaper. Women tend to have more omega 3 fatty acids, EPA plus DHA, as they have more soluble fibers like psyllium husk, oat brain. And these details are beyond this because it's a lot of else stuff. Commonly used garlic extract, vitamin E, beta carotene, red yeast, and rice. Wonderful.
So this was fantastic, Dr. Chopra. I think you've really made us understand exactly how to address cardiac health, especially in women. So thank you for coming and thank you for enlightening us. Thank you so much.
Women are very important to me, and I'm a very hardcore feminist.
That's
So you can
amazing.
always hope for me.
Yes.
If anybody troubles you, let me know.
Thank you. Thank you, Dr. Chopra. Thank you for coming.
Okay.
Thank you.